Good morning, everyone. Nice to be here. As we just heard, the ENN actually started in Trinity College in 1996. And then we moved over to the UK about 8 years after that, actually so we could watch proper football. That was the reason. The guy's holding the ball there, actually. I've been looking at that for... Okay, so the ENN, it is essentially an organisation that does knowledge management, and by that I mean that over many years we have tried to capture experiences of programming around nutrition and nutrition-related sectors. We do this in various ways. Most notably, we have a publication which is past its 50th issue currently, called Field Exchange, and it's written by practitioners in the field running nutrition-specific and nutrition-sensitive programming. We're also an organisation that's involved in research, primary research, most recently on cash and nutrition programming, and also, I guess, what you'd call soft advocacy. Because we have a very, very large network, we're privileged to see a very wide spectrum of programming experiences, and then we can extrapolate upwards from there to try and understand why programming is working or not, and how the institutional architecture around nutrition supports programming or doesn't, and what might need to change. Now, resilience is an interesting term for nutrition, because I would argue that the resilience discourse hasn't really been penetrated by nutrition. And equally, the nutrition sector hasn't really imbibed resilience thinking. And it's interesting to hear the presentations today, especially also Simon's initial presentation about what resilience is. To me, over many years that I've been thinking about resilience, it seems to me it's quite a simple concept. It's about an individual or a household or a community or a national set of systems being able to withstand stresses and shocks, and certainly bounce back, but not to be least affected by shocks. Now, as I understand it, the resilience discourse and all the investment around resilience happened because it was becoming increasingly obvious that annual repeated humanitarian programming really didn't lead to great change. We kept having to invest short-term in highly vulnerable areas, fragile contexts, and it wasn't a very efficient way of building up people's capacity and reducing their risk. And at the same time, in the last 2 or 3 years, we've seen the rising up of the agenda of the so-called humanitarian development nexus, which again comes from the same place, and this is because you have something like 70% of emergency programs taking place in countries which have had 7 or 8 consecutive years of humanitarian programming. So in other words, the humanitarian development nexus, the HDN, and the resilience discourse are very connected. In that sense, they come from the same place. Now, ENN has recently been providing knowledge management support for the SUN movement, the Scaling Up Nutrition movement. And we are focusing, because of our history and emergencies, we're focusing on fragile and conflict-affected states. And as part of that focus, we are looking very much at the humanitarian and development join, the linkages, and to see how humanitarian aid can be leveraged to better effect, to strengthen development, and equally how development programming, longer term programming, can speak more to the humanitarian or fragile context. And our first case study, one of many we're hoping to conduct over the next 2.5 years as part of this work for the SUN movement, our first case study was Kenya. And it was a fairly short piece of work, but we were encouraged to look at Kenya first because we'd heard that Kenya had made enormous strides in linking much better the humanitarian investment with development, longer-term programming, and had managed to set up systems at country level which reduced the risk emanating from drought. So what we did is we spoke to a number of stakeholders. We looked at the experience of 2011 drought versus the 2016-17 drought. And in 2011, everyone acknowledged that the response was very late, it was poorly coordinated, there were low levels of government leadership and coordination, and there had been very little attention to resilience building prior to the 2011 drought, particularly in the 23 ASAL counties, the arid land and semi-arid land counties. So that consequently, when drought hit in 2011, levels of wasting, levels of acute malnutrition rose spectacularly. 2016-17, a very different picture though. By all accounts, the government managed to respond much earlier, and they were able to scale up treatment of acute malnutrition and have spectacular outreach in these northern counties most affected by drought. And also government had managed in the intervening period to set up social protection programs, the Hunger Safety Net program, the Orphan and Vulnerable Children program, programs for the elderly. These are programs much like our welfare states, although much less well-resourced, obviously. There was also much more intervention at local level. Excuse me a second. I have a bit of a sore throat, sorry. Much more intervention at local level, so that county governments were able to respond much more appropriately and much earlier as well, because they had drought contingency funding. So they didn't have to wait for a flash appeal, an OCHA appeal. In fact, the OCHA, the humanitarian appeal, happened 6 months after declaration of drought in Kenya. So that the humanitarian response effectively just became a gap-filling exercise. The humanitarian actors looked to see where government needed extra support around treatment of acute malnutrition, around water and sanitation, upscaling, around social protection, and plug those gaps. So in many respects, to my way of thinking, this is like a gold standard model for how fragile countries should actually be moving. Greater government investment, much more decentralized response, humanitarian investment, supporting and building the capacity of government systems. I don't want to pretend that Kenya is wonderful, because of course it still has enormous challenges, particularly around nutrition and where it's positioned in government architecture. However, the model of Kenya for drought response, for resilience building, for risk minimization and early response, I think is something we could all look at. In Kenya, I think there have been a number of enabling factors which have led to this relative success story. First of all, the government's been doing very well, pretty well economically, so it can spend more. It's become a low middle income country. There's much more strong government leadership around drought response. They have a national drought monitoring authority. They have an ending drought emergency framework, which includes nutrition, although just stunting. I'll come to that in a minute. Devolution of government in 2012, spectacular difference. Counties vary in their resilience investment, but a county like Wajir, which only recorded a 16% level of GAM compared to, say, Marsabit, where it was over 30%. You can look and make associations with the way government has invested when they've invested in risk minimization. Health systems have been strengthened in the intervening 5 years in Kenya between 2011 and 16, so that health systems can now scale up treatment of acute malnutrition based on trigger levels at health center level. And as I mentioned before, government funded and led social protection systems allow scaling up, and that is something that can be built upon. Now, if we kind of think about this in terms of how does all this fit together? What's our conceptual framework for humanitarian development linkages or nexus, for resilience building? And a simple way that I'm beginning to think about this, and I'm sure this will change as we do more work in other countries, is that you have global level frameworks and initiatives and institutions and processes which are driving this humanitarian development linkage or nexus agenda. You know, these are the Grand Bargain from Istanbul, new ways of working that OCHA are introducing. And then you have the intermediate level shifts which arise from this, and this may be around multi-year funding, So no longer short-term humanitarian funding, multi-year funding, incorporation of disaster preparedness into national nutrition plans, multi-sector programming, all these things result from this more global framework thinking. And then below that, you could have nutrition resilience building. Now, it's interesting, I haven't heard the term nutrition resilience here. And it's something I kind of, I grapple with, and so do my colleagues in ENN. What is it? Should we have a separate term for nutrition resilience? Should we have a separate term for food security resilience? Should we have sector terms for resilience? Because they would be different things, wouldn't they? For example, individual nutrition resilience would be about someone's nutrition health and health status, their physiological and biochemical status. At household level, it would be about being able to having assets enough so that when a shock occurs, you're not affected from a nutritional point of view, and you can maintain the nutrition status of your household members. At community level, it's about strengthening the ability of the community to access services. And at national level, it's about sustaining capacity of key shock responsive, nutrition sensitive services like social protection, like health systems, etc. This is just a working definition, but it gets you thinking about how resilience can be applied to different sectors and to different outcomes. So I think I'm drinking your water, sorry.
Don't worry.
Sorry, I'm trying to cram a lot in here, but hopefully you can ask questions if it's too confusing. An area of work that ENN have been very involved in recently has been looking at the relationship between wasting and stunting. For non-nutritionists, that's the weight of someone, whether they're thin or whether they're short. Because traditionally, wasting is seen as an emergency problem. Weight loss is seen as something you deal with in emergencies, and height deficit, stunting, is something is a longer-term issue. Now, we're beginning to challenge that, as are other researchers and groups around the world, because we've been doing a lot of analysis of data sets, and we're finding, for example, that if you have a child who's stunted at 2 years old, they're more likely to have been wasted in the first 20 months of their life, and that a period of becoming wasted or having fluctuating weight increases the risk of a child becoming stunted in the next 3 months by 3.2 times. And the reverse also applies there, that if a child is stunted, then in the next 3 months there's a 1.8 risk of that child becoming wasted. So the relationship between wasting and stunting is very close. We don't fully understand it. Work is ongoing on that, but it does raise the issue of why have these silos, wasting for humanitarian, stunting for development work, and the need to bring, at least in the nutrition sector, humanitarian and development programming much closer together. So I'm just going to finish with a set of questions which I think are something some of you might want to raise or discuss. I think for me there are certain questions around nutrition resilience which we would like to answer in the near future. First of all, how do national nutrition plans, of which there are an increasing number now, particularly within some countries, how do these plans articulate disaster preparedness and resilience building? Do they acknowledge the concept of nutrition resilience, or even resilience in general? A second question, and we've heard our two presenters before talk about this: what type of nutrition sensitive or resilience programming reduces and mitigates nutrition risk, and how do we measure this? It's really nice to hear about these two programs which are successful, because so often we hear that you can't show nutrition impact in research studies around nutrition sensitive programming. Another question is, should we be setting up standards to judge our success? And I think the answer is yes, to judge our success about increasing nutrition resilience. So in countries where you have repeated humanitarian programming, should we be saying, okay, every time there's a drought, we expect to see less and less nutritional risk? And should those kinds of standards be incorporated in, for example, the SPHERE standards? And then there's a question also about social protection, which is becoming a bigger and bigger activity in so much humanitarian and development work. How can we make social protection programming more nutrition sensitive? And then finally, some questions around this whole humanitarian development nexus, or the linkages. So we have questions which we're going to explore over the next 2 years about what are the opportunities for strengthening humanitarian and development linkages for nutrition. What do they look like in countries at different ends of the fragility spectrum? So we have Kenya at one end, which is now a low middle income country, decentralized, got all kinds of government systems to support the vulnerable. And then at the other end, you have South Sudan, Somalia. So what are the opportunities in these more fragile contexts to strengthen these linkages and move towards the Kenya gold standard or silver standard, if you like? I think there are also important questions for us around the proportion of overseas development aid, which supports governments to articulate policies and frameworks and implement programs which build capacities and systems for resilience to protect nutrition status. Simon talked about the complete absence of data around resilience programming and the spend. We talk about resilience so much, I don't think it's good enough really that we don't have data to show how much we're spending on this, as well as what the impact is. And finally, as a question which is quite a sort of specialist question, but it relates both very much to humanitarian and development actors, is that how can multi-sector nutrition programming in humanitarian contexts? So at the moment, the Global Nutrition Cluster is trying to get all the clusters to work together more and implement multi-sector programmings. So how can those initiatives be leveraged to help governments more longer term think multi-sectorally, to bring all their sectors together to support nutrition objectives, which after all is a key objective of the Sun movement. Okay, I'm going to leave it there, and thank you for listening.